Welcome back to New Day Cleveland. It can be a very embarrassing problem to have. We're talking about excessive sweating, but there is a new procedure that can be very successful in treating this condition. Welcome Dr. Goldman from Beachwood Plastic Surgery. Good to have you here.
Thanks for having us, Natalie.
I met him way back when. I wanted to do a story about how to look younger without going under the knife. Your place is great for things like that, for women, for men.
We do more of that than sweating, that's for sure.
That's for sure. So, okay, when we discuss this and we're talking about excessive sweating, we're going to focus specifically on the armpits.
Yeah. So is
there a better term for them? Just, it's under your arm.
You can call them the axilla.
Yeah, that's not as fun.
Armpits.
Okay. So what is this a new procedure that's out, or has it been out?
So it's sort of a new technology, right? So it's a new technology based on an old technology. This is Miradry. So it's a device that uses microwaves, the same microwaves that you guys have in the oven over there.
Interesting.
Microwaves target water, so they heat up water. So if you target the microwaves to the armpit, the sweat glands have a lot of water in them, so it heats up the sweat glands and it destroys the sweat glands.
So what is if we're looking at it now, this is what the procedure is like? Does it hurt at all?
So basically we use numbing medicine.
I was going to say, she looks happy, she's smiling.
So you feel the numbing medicine, which isn't that bad, it just takes a minute. And then the device itself, although it's heating up the skin, or really just below the skin, because the skin is numb, you don't feel it.
So does this take one treatment, or how many do you go through?
So we recommend 2 treatments, and with 2 treatments, there's probably over a 90% success rate in eliminating or drastically reducing excessive sweating.
And then would you have to do this, say, after 5 years, after 10 years again?
So the device has been out for, I guess, a couple of years, so we don't really know what these patients are going to be like 20 years from now, but all the evidence suggests that it's a permanent treatment. So basically these sweat glands don't start working even a couple of years after the treatments that have been done, so there's no real reason to think that they're going to regenerate after that.
So when people come to you, what's one of the biggest questions they ask you? I think they'd be worried about...
So people ask, what happens if you can't sweat in your armpits? Don't you need that sweat?
Don't you need to be able to sweat?
But it's really a very small percentage of your body's total sweat, like maybe 2 or 3%. And since, when you're running or something, you feel sweat all over, so your body can still cool itself effectively. And what happens is the people who have noticeable sweating in their armpit really have kind of overactive nerves there that are causing excessive sweating that isn't really physiologic. It's not helping you cool off. It's just excessive. So it's not a problem to eliminate that.
So this may be a weird question, but do you still use deodorant then?
Okay, so some of the people, so it's FDA approved for excessive sweating. Medical words, hyperhidrosis is excessive sweating, and maybe 3% of the population has that. But some of the people who come to us don't want to use deodorant. Either they don't like the chemicals, they don't like they have rashes from the chemicals, or whatever. So some of the people do this to avoid using deodorant. Some people do it because even though they don't have excessive sweating, they want to reduce any visible sweating through clothing and so forth.
Now, how do you know you're a candidate for something like this?
So the best way to find out is to come and see somebody who's credible and has had good experience with the machine and basically go through the evaluation. There are objective ways to measure sweating, like their little meters and so forth, which frankly we don't use because it's the history, it's what a patient describes as their problem that's most important.
Now, it's only working on the armpits. This isn't...
Only FDA approved for the armpits.
For the armpits, okay.
So,
because I know there are other places that people have sweating problems. I know hands can be a big issue for people.
So,
and it is also, it's embarrassing.
Right, it's embarrassing. So hands is another site that certainly people talk about. Probably the second most common question we get is the hands. There's no FDA approved sort of hand piece for this device yet, although there's rumors that that's present for the future, or coming in the future.
Can I ask you how much it costs?
You can.
Okay.
So basically 2 treatments is $3,000.
Okay.
So the first treatment is $2,000, the second treatment is $1,000. Really most people should plan on doing 2 treatments if they want the full effect. And there are a small percentage of patients who don't get the full effect. They can be treated a 3rd time. If they do, we price that very low. But in fact, there may be a small percentage of patients who, for whatever reason, don't see a full response.
Very interesting. The technology that's out there is really remarkable. Thank you so much for being here. Dr. Goldman.
It's always fun, Natalie.
Go check him out on the east side. I think you'll be very pleased with his with everything that he has to offer there.
We're on the west side, too.
Oh, awesome. Okay, east or west side.
Crocker, Parker, Beachwood.
Check it out. All right. New Day Cleveland continues right after this.